Hey everyone, welcome back. It is Monday and it is another week. I think it's week 6 at this point. I've lost track, but I think it's 6 of Lunch Break Live with me, Ivana. And today I have got our own Dennis Pillion here to talk with us a little bit about a story he wrote this weekend that talks about these proposals for reopening Alabama. It's really important to go ahead and note that neither Governor Kay Ivey nor the state health officer has signed off on any plans to reopen the state or to take away any of those measures that were put in place earlier this month. But there are plans out there and proposals that people like Lieutenant Governor Will Ainsworth have proposed. So Dennis wrote about that this weekend. He went really in depth on some of these plans that gave really specific examples like how to open barber shops, retail stores, restaurants. One that Dennis referred to as a non-essential shoe store, which I'm a little bit personally offended by, Dennis, as evidenced by my background. But Dennis is here. He's going to tell us a little bit about these plans. And thanks, Dennis, for coming on and keeping us updated with what could be in the works for Alabama.
Absolutely, and for the record, I did not make the call about shoe stores. That's over my pay grade. Sorry.
Got it. Fair enough. Me too, obviously, because I spend my pay on them. So first of all, by the way, if y'all have any questions about these proposals, feel free to shoot them in the comments. I will ask Dennis, and if he doesn't know the answer, we will do our best to find out for you. But again, disclaimer: the governor nor the state health officer has signed off on any of these plans. So at this point, they are plans, they are proposals, they are just that. They are not anything set in stone. So, Dennis, tell us a little bit about these plans that you wrote about.
Yeah, so really, I mean, we're very much in uncharted territory here. There have been, Lieutenant Governor Ainsworth came out last week on Friday, I believe, with this proposal for reopening small businesses. He was the head of the Small Business Emergency Task Force. And they really had a lot of very specific suggestions. They're just suggestions at this point, as you said. Nobody has actually taken action on any of them. But for things like limiting the number of customers to come into a store, for businesses like tattoo shops, places like that. Really strict hygiene requirements. Barber shops under I call it the Ainsworth plan. Really, it's the task force, which included the lieutenant governor, a bipartisan group of legislators, and the Business Council of Alabama was part of it. The Alabama Retail Association. So there were a lot more people putting input into that, but we sometimes just call it the Ainsworth plan for simplicity's sake.
And that came out on Friday, right?
I believe so, yes, if the days kind of run together, but I believe that was Friday.
So what were the main points of that plan, generally speaking, about opening and how to open?
Yeah, so generally, everybody wants to reopen. There's a tremendous economic pressure, a lot of people out of work right now, but everybody also wants to do it safely. There's this. We want to get people back in business. We want to allow, or the state wants to allow, the businesses that can operate safely, without kind of fueling another outbreak to do so. So this plan, it includes some businesses, he said, restaurant dining rooms, some retail stores, your shoe stores. They're saying these businesses can open right away. If they follow these kind of set guidelines. And those are things like limiting the number of customers in your store, having more hand sanitizers available, rearranging your checkout counters so that people aren't waiting next to each other in line. And there's some really specific examples of things like that for ways that businesses can operate safely and keep their business going while kind of minimizing the risk to their employees and their customers. And those recommendations are a little bit different for each kind of business. I mean, that plan covers jewelry shops, barber shops, retail shops, schools and daycares, all kinds of different businesses, medical, small doctors' offices, dentists, things like that.
So something that I thought was interesting you talked about in your reporting is you took a look at some of the specific examples that was in that proposal that we're calling the Ainsworth plan, and you went through barbershops, retails, restaurants, and there were some interesting caveats in each group. So let's start with barbershops. I know there was last week a little bit of talk about barbershops after one barber in Shelby County said he was going to open his salon, which was the mail room in Shelby County, but he ended up not doing that on Friday. Said he was going to, ended up not. There were some issues. He said he talked to state legislatures and people higher up, and they advised him not to, so he didn't. But in this plan, the plan says, these barbershops can reopen under these guidelines. So what are some of those guidelines for hairdressers?
So for hairdressers, they break the businesses down into different categories. So barbershops, hairdressers, salons would be under what they call close contact businesses, where to make it work, it requires an employee to be in close contact with the customer. So in the Ainsworth plan, that would mean basically all waiting rooms would be closed. He said, if possible, customers should wait in their car until the business is ready for them, and then they could come in. There would be no walk-ins. All haircuts, salon appointments would be appointment only. So really just kind of keep the absolute minimum number of people possible inside the building. Right. The number of stylists or barbers that would be allowed to operate would be half of what it usually was. So say you would have, instead of 4 chairs in a row, you'd have a chair and a gap, and then a chair and then a gap. So a lot of things like that. And actually, for barbershops and hair salons, they already have pretty strict hygiene and cleaning requirements. Mm-hmm. So there was not a lot there.
What I think is interesting is, I know this is a little bit different for the guys and for the barbers, but for the hairdressers, for people who do a little bit more to their hair, I know when I go and see my hairdresser, and shout out to Whitney, she's a goddess, but I will go there and like a lot of women, if you get highlights or if you get your hair dyed or if you do something like that, I know that they're talking about taking away waiting rooms or not using those waiting rooms or waiting areas. But if you're getting something else done to your hair, sometimes you have to sit and let that either soak in. You have to sit under heat. A lot of people, probably know what I'm talking about. A lot of the other men or people who don't do that don't. But that presents a problem for a hairdresser if they can't be seeing clients in the meantime while one person is waiting for their color to set or other things.
Yeah, and I think I'll have to confess a little bit of ignorance there because, my hair appointments are pretty quick in and out. Right. But, another part of the Ainsworth plan is to take away reading material, because obviously if you touch a magazine, touch a book, and then someone else touches it, that could be another way for the germs to spread. I think if we have a reopening like this, if this is the way we choose to go forward, it's not going to be like reopening the floodgates. There's not going to be somebody flips a light switch and we're back to the way things used to be. There are still going to be significant limits put on these businesses probably. The way one of the authors of one of the national plans puts it is there is not a V-shaped recovery. It's not instantaneous. We ease back on the restrictions a little bit. We kind of monitor that, see how it goes, see if we get a big increase in cases. If we don't, then we ease back a little bit more, allow a few more things. And that's really probably how it's going to be until we get a vaccine or until there's a better, reliable treatment out there that we can roll out to a large number of people. So it's probably going to be kind of, we're not turning the floodgates on. We're just opening the faucet up a little bit.
Right. It's not flipping a switch. Another thing that I thought was interesting that you mentioned in that story and that was included in that report is restaurants. I know that's something that a lot of people are waiting on. Luckily, nobody in my house has gotten sick from my cooking yet, but it's probably coming. We need our restaurants. So what are the kind of restrictions that were talked about in the proposal for restaurants?
Yeah. So one of the proposal for restaurants is that dining rooms could open immediately under a limited capacity, as long as the tables were at least 6 feet away, I believe, and there was enough space there in between tables. I know that's in the plan. That would not be some of the prominent restaurateurs in Birmingham have already come forward and said, we don't really think we could do that. That to reopen their dining rooms in such a limited capacity, they're not 100% sure that they could keep their customers safe, or they could, stop the virus from spreading in their stores. So, and they obviously don't want that. But then there's also, if they're making it on takeout and delivery, curbside pickup, that kind of thing, I'm not sure. There's definitely some hesitation there for some restaurants to reopen their doors and have customers in their dining rooms again.
Right. And then you run into the issue that I think we've talked about before is bars. It's very hard to go to a popular bar in town. Dennis and I are in Birmingham, but a lot of people I know, our viewers, are in different cities. But in a lot of cities, you've got these bars, and it's very hard to find one where the seats are 6 feet apart, or even several feet apart. I mean, bars, that's kind of the appeal, is that the chairs are close together, you have an intimate setting. How would these places that are specifically bars or restaurants that depend heavily on their bar seating space, how would that work for them?
So I will have to double check. I read several different plans, but I don't believe bars are included in the Ainsworth plan at all. I believe there is not a plan for a safe way to reopen bars. So I don't know when that would be coming.
Got it. Now, some of the other places you talked about were retail shops. You mentioned in your story that in that plan there were talks about checking the temperature of workers and making sure that there is a designated employee of the store, maybe an assistant manager, who is kind of a safety officer and who's in charge with everybody's health and making sure that people are not spreading that sickness in the store. There were talks about limiting the amount of people in a store and even subbing, like you said, in shoe stores, benches where people sit down to try on shoes for singular chairs, so you can't be sitting next to somebody. Those are all pretty extreme measures.
Yeah, well, and like we said, we really can't state this enough that these are all just proposals. No one is saying, you have to do this to be able to reopen your store. That's not something that's really being talked about right now. The Ainsworth plan does include temperature checks for employees at like medical facilities, places like that. It would not be in the plan for like retail stores, like shoe stores.
So that's a good reminder for our kind of middle of the video disclaimer. If you're just tuning in, we're talking about some proposals that have been proposed and that have been talked about. Nothing is final. Governor Ivey nor the state Department of Health official, Dr. Scott Harris, has signed off on any of these proposals. So right now there is nothing official, nothing for reopening. Dennis and I are just talking about some of the proposals that have been talked about in the state. So getting that out of the way, this Ainsworth plan and some of the other local ones, there are some national ones. Now, how do these local ones, the Ainsworth plan, compare to things like the CDC's plan?
So I would say the Alabama plan, which was developed by Lieutenant Governor Ainsworth, and he's the head of the Alabama Small Business Reopening Task Force. That was probably the most specific plan that I saw on here's what we recommend for a barber shop. Here's what we recommend for a retail store. And it really had a lot of very specific guidelines. Most of, so the CDC and FEMA, they have a draft version of a plan. Obviously, they're still working on it. but that kind of included more of a national big picture strategy. Things like there have been discussions about, as I say in the story, creating a COVID-19 corps where the CDC or the federal government goes in and trains people to work in public health roles as like contact tracers, where they're reaching out to people who have tested positive and seeing, okay, who have you come in contact with in this time where you've probably been contagious? We need to find those people and try to get them tested. So that's part of the CDC plan. There's a group called the American Enterprise Institute, which is kind of a business-focused national group. They have come out with a plan that was written by Scott Gottlieb, who is the former chairman of the FDA, and some MD PhDs at Johns Hopkins, I believe, School of Public Health. And they really have their plan has some recommendations for things about like creating voluntary shelters where people can go, say, if I test positive, but I have 6 family members in my house, I'm living with my mother who's high risk, whatever, I can go free of charge and stay in this kind of quarantine center to self-isolate myself until I'm out of this period of contagion. That a lot of the national plans deal with ramping up testing and with these kinds of the public health aspects, really, of trying to spot outbreaks before they really get out of control and limit the spread that way, rather than saying what people who work at a shoe store should do.
Right. I thought it was really interesting, the mention of the possible app or other kind of phone plugins, you can say, to trace who you've been in contact with. I thought it was really interesting. If you haven't read Dennis's story, there is a part in there where he talks about some national talk about development of an app that will let you know if you or if somebody you've been in contact with tests positive in X number of time. It will alert the people who you've been within a certain feet of who has a smartphone that is equipped with that app. That technology is way above my head. That's about all I can explain probably on that. But Dennis, is there any more talks about that app? And would that be in these national plans? Is that something that would be mandatory?
So, and again, these are, I don't know that I have seen a government source talk too much about that. That contact tracing app, Apple and Google, they make the 2 big phone operating systems. They are already working together on how to integrate a public health app like this into their operating systems. This was part of the American Enterprise Institute plan that I mentioned earlier. And it would not be mandatory, but they have talked about different ways to try and encourage people to sign up for it. Obviously, it can give you some peace of mind to know that if I've crossed paths with somebody who has COVID in the last week, then, I'm going to get a buzz and alert on my phone so I can know whether I need to go get tested or not. But also, they've talked about things like, like airlines when, for air travel, let's face it, a lot of people don't want to fly on a plane right now. And one way that they could try to make it safer is say that we'll only allow people to fly on our airline who have this app and who, show they're using it.
Right. I have a couple. Oh, go ahead.
No, yeah, go ahead.
I have a couple of interesting conversations happening in the comments. That's a tongue twister. Sarah and Casey both bring up a good point about if there are trouble we're going back to the local plans, the Ainsworth plan. If there are problems for healthcare facilities in getting masks, gloves, other PPE or cleaning supplies, how are we going to ensure that places like salons, if they are allowed to open, have those necessary cleaning equipment or protection equipment? And
that's going to be a huge issue as we go from these kinds of proposals to what actually gets enacted, because I know, I'm sure they would love to have plenty of protective equipment, but there's a shortage right now. So how do we kind of make sure that healthcare workers have what they need to do their job? And, that retail stores can have some to put some of these in place. All of the national plans, the state plan didn't really address this much, but all of the national plans include ramping up production of PPE, of that protective equipment, masks, gloves, face shields, those kinds of things. And I think the idea is that as we start ramping up manufacturing, that we would be able to have a little bit of a surplus that we could give out to retail stores and businesses like that.
There's also a lot of talks about in these comments about masks. Wearing masks to stores, would that be mandatory? Would that be voluntary? And also the different conversations that I think we've all thought about if we are encouraged to wear masks when life reopens. And say you do go to a restaurant, you can't obviously eat or drink with a mask on. So how are those requirements or proposed requirements for masks working out?
So for the small business plan, the Ainsworth plan, most of those, they say the businesses should encourage their customers to wear a mask, and they should allow the employees to wear a mask. A lot of like retail stores would not be required to let the workers to have the workers wear masks. I think Walmart came out this weekend and said that they were going to start doing that. But again, you run into serious supply issues when you start requiring someone to wear a mask. How do you do that when there aren't enough masks? It's tricky. So right now, most of the plans, it says things like encourage customers to wear masks, allow employees to wear masks, but a lot of it would not be mandated right now.
This is more of a comment than a question, but somebody made a really good comment. I'm trying to figure out who it was and give you credit. Jan, we talk about restaurants, and we talk about having to keep the tables 6 feet apart, possibly, or just stay far apart from your closest neighboring table. Jan brought up a good point saying, at least the warmer weather is here. We live in Alabama. It's already getting hot. And a lot of our restaurants do have outside seating. And, that might be a good opportunity for restaurants if they are open and required to have those distancing requirements. They can maybe pull some of those tables outside, set them out on sidewalks, or pull them apart in that way to at least get people able to out and eat, but do it in a safe way if these proposed plans are signed into place.
Yeah, and that's really, what Ainsworth says is the major goal of his plan is to, in certain situations where the business can't operate safely, to give them the opportunity to do that.
Are there any talks in any of these plans, whether it's our local proposed plans or the national proposed plans, about increasing of fining people who don't follow restrictions or shutting down businesses that don't follow the social distancing requirements or sanitary requirements or anything like that? Did they talk about any sort of enforcement?
It's not a huge part. Obviously, we're under an order from the state health department right now to shelter in place, to close non-essential businesses. If people, willfully violate that order, then there are penalties in place. I don't think any group really wants to fine anybody during this thing. I think they are really just hoping that everyone will comply. It's not, even like, this is the United States. This is not South Korea. Has a lot more mandatory measures that are in place. China, obviously. We're really hoping to kind of persuade people to abide by these rules and these recommendations, and not have to put a lot of penalties behind it. So that's not really a big focus of the plan. But I think the current legal power that state health departments, the local health departments have, would still be in effect. So if, the state of Alabama issued a public health order with these conditions, then there would be some legal strength behind that.
I was just looking at some of these comments and conversations happening, and there are some, I think it was Lynette. She was talking about getting takeout. Lynette, that is something Dennis and I had already talked about before we started this, about our getting takeout. Like I said, nobody's gotten sick from my cooking at this point, but it's close. I can feel it. Takeout's a huge thing right now, and personally, I encourage you to support your local restaurants and do that takeout, because right now that's all we can do. Those restaurants are not open right now for dine-in, and that's the best way to support them right now is through takeout. So yes, Lynette, we are doing takeout. I'm spending a lot of money and probably gaining a lot of weight doing it.
It's worth it.
It's 100% worth it. I totally agree. Nobody can see me now anyway, so that's fine. Is there anything else? I'm looking through some of these comments, and I'm going to link for y'all Dennis's story. I'll pin it at the top of these comments so y'all can check back, read a little bit about what we're talking about, and see those plans. And then you can maybe, if you are new to this conversation, you can go back then and listen to Dennis and my talk about it after you read that. Thank you so much, Dennis. Is there anything that we're forgetting that is a major point of these plans that you want everybody to know?
I think the big takeaway is just that we don't know exactly what's going to happen yet. We don't know. Some of these things might be required. Some of them might be just recommendations. And some businesses, I've already seen this, are kind of going above and beyond what's required to make their customers feel safe and to do whatever they can to limit the spread of this virus. I went grocery shopping yesterday, and the store had a box of latex gloves out in the lobby for anybody who walked in. So, okay, yes, I will put gloves on before I pick out my groceries.
Right.
So I think we're very uncertain about how this is going to happen. But I think everybody also needs to understand that it is not going to be flipping a light switch. There's going to be kind of a gradual phasing back to normal life. And for these businesses, even when they reopen, they probably will not be reopened at the levels that they're used to. They may have a limit on the number of customers they can have, or they may, if you're a restaurant, your dining room, you're limited on how many tables you can fit in under the new guidelines. So there's going to be a lot of change, and we don't know exactly what it's going to look like yet, but it's important to talk and for us to think and plan and kind of consider what that might look like, because it's going to be probably many months before we have a vaccine, before there's this kind of herd immunity that develops. So we're going to have to be really cautious about how we deal with this virus for the foreseeable future, I think.
That's right. You make really good points there. And just daily reminder, if you need it, we're in this together. We are all going to go through this new normal together, or whatever you want to call it. None of us have been there before, but we're going to get there. So, Dennis, thank you so much for sharing all your knowledge on these plans and talking through with us what some of these proposals could look like. And maybe soon we will know a little bit more about what they will look like instead of could. So thanks again, Dennis. We appreciate you so much.
Thank you.
And for everybody else, we will see you tomorrow.